Global efforts to tackle the corona epidemic intensify. Prime Minister Modi attends the G20 summit via video conferencing. The Prime Minister discusses COVID-19 pandemic with the Crown Prince of Abu Dhabi and the Emir of Qatar over telephone. The number of active cases of COVID-19 in the country has increased to 633. 44 people have so far been discharged from hospital after the treatment. 16 people have died. Odisha to build the largest hospital dedicated to COVID-19 patients. Air India flies out more than 300 Israeli citizens from New Delhi to Tel Aviv. Central government issues guidelines to maintain the availability of essential commodities. The Home Affairs Ministry instructs the Chief Secretaries of all the states to facilitate home delivery, e-commerce and the supply of essential goods. WHO Director General calls on the G20 leaders to fight, unite and ignite against COVID-19 as the outbreak rages across the globe with over 4.5 lakh confirmed cases and over 21,000 deaths. China reports no new locally transmitted infections and sees a drop in the new imported cases. The number of coronavirus infections in the U.S. surpasses the tally of China. House of Representatives to take up today the $2.2 trillion coronavirus relief bill passed by the Senate. Hello and good morning. You're watching Doordarshan News with me, Nancy Kohli. A top story: Prime Minister Narendra Modi participated in a G20 virtual summit to discuss the issues related to coronavirus. In a statement, the G20 nations pledged a united front in the fight against the coronavirus pandemic and said that they were injecting $5 trillion into the global economy to counter the impact of the crisis. Prime Minister Modi thanked the King of Saudi Arabia for convening this extraordinary session of G20. In his remarks, Prime Minister Modi noted the alarming social and economic cost of the pandemic. He added that 90% of the COVID-19 cases and 88% of the deaths were in G20 countries, even as they share 80% of the world GDP and 60% of the world population. The Prime Minister called on the G20 to come out with a concrete action plan to fight the global pandemic. Prime Minister Modi underscored the need to put human beings at the center of our vision of global prosperity and cooperation, freely and openly sharing the benefits of medical research and development, and work together to reduce the economic hardships resulting from COVID-19, particularly for the economically weak. Prime Minister Modi also called on the leaders to help usher in a new globalization for the collective well-being of humankind and have multilateral fora focus on promoting the shared interest of humanity. And the External Affairs Ministry spokesperson Ravish Kumar in a tweet shared the highlights of the virtual G20 summit. These highlights include the need to put human beings at the center of our vision of global prosperity and cooperation, freely and openly sharing the benefits of medical research and development, develop adaptive, responsive, affordable and humane healthcare system. Also promoting new crisis management protocols and procedures for an interconnected global village. Strengthening and reforming intergovernmental organizations like the WHO. Also focus being on working together to reduce the economic hardships resulting from COVID-19, particularly for the economically weak. Prime Minister Modi had a telephonic conversation with the Emir of the State of Qatar, Sheikh Tamim bin Hamad Al Thani. The two leaders discussed the ongoing developments related to the COVID-19 global pandemic and its social and economic impact. The leaders exchanged notes about the measures taken in the respective countries to contain the spread of the virus. Both the leaders expressed hope that the efforts and the measures being taken to stop the spread of the virus by all the affected countries would yield early and positive results. Prime Minister Modi thanked Amir for his personal attention to the welfare of the Indian nationals living and working in Qatar, particularly in the present situation. The Amir assured Prime Minister Modi about the safety and the welfare of all the Indian expatriates in Qatar. Prime Minister Modi also spoke on the telephone with the Crown Prince of Abu Dhabi, Sheikh Mohammed bin Zayed Al Nahyan. The two leaders exchanged information and views on the ongoing COVID-19 pandemic, the situation in the respective countries, as well as the steps being taken by their governments. The Crown Prince assured Prime Minister about the welfare of the over 2 million Indians living in the UAE. Prime Minister Modi thanked the Crown Prince for his personal attention to the health and the safety of the Indian expatriates in the present situation. And the centre has asked the state governments to deploy additional medical facilities and fiscal resources for fighting COVID-19. A look at the latest data regarding the spread of the coronavirus in India indicates that the total number of active cases of COVID-19 has gone up to 633. 16 deaths have been reported due to COVID-19, while 44 people undergoing treatment have been cured and discharged from the hospitals. The highest number of cases have been reported from Maharashtra and Kerala. And the Union Home Ministry on Thursday issued standard operating procedure on the availability of the essential goods during the lockdown period and asked the state governments to ensure smooth functioning of the people and the services. The ministry said that there should be no interruptions in the services of the small retail shops, large organized retail stores and e-commerce companies. The SOP said in order to ensure smooth functioning of these three types of operators, it is important that the constituents of the supply chain are also allowed to operate. It also allowed movement of transporters, drivers and loaders of the essential goods from the place of manufacture to wholesalers or retailers. The SOP said that such transportation may involve intra-city, intercity in the same state or union territory, or interstate movement of essential goods and manufacturing units of essential goods, including drugs, pharmaceutical, medical devices, their raw material and intermediates. The SOP also said that all the facilities in the supply chain of essential goods, whether involved in manufacturing, wholesale or retail of such goods through local stores, large brick and mortar stores or e-commerce companies, should be allowed to operate, ensuring strict social distancing. The employees or persons engaged in the supply chain shall be allowed to commute on the basis of certification issued by the local authorities concerned, and these people shall carry a valid photo ID card. The state governments shall open a 24/7 control room to register complaints or grievances and share these numbers widely. And the centre has also issued a notification advising all the state governments to ensure home delivery of the medicines from the pharmacies. The Union Health Minister, Dr. Harshvardhan, has advised all the states to start a helpline for patients living in quarantine to take care of the mental health of such patients. The minister informed that telemedicine guidelines have been issued and an application is being started for the same. The health minister has asked the states to identify those doctors who would use the app to advise the people living at home. And let's now go across to our correspondent Nitendra Singh to get the very latest as far as the COVID-19 situation across the country is concerned. Nitendra, first of all, even as the increase in the rate of the coronavirus case is increasing, but that's increasing at a stable rate. So that's something that a news of relief in these challenging, tough times for all of us. And the latest directive that's been coming from the health ministry as far as making medicines available to those in need is very crucial and critical at this point in time.
जी बिल्कुल। अगर संक्रमण की बात करें तो कल स्वास्थ्य मंत्रालय ने भी ये कहा था कि जो संक्रमण इंक्रीज कर रहा है तो उसके रेट में कमी आई है। और अच्छी बात ये भी है कि इलाज के बाद लोग ठीक भी हो रहे हैं। अब तक 44 लोग इलाज के बाद ठीक हो चुके हैं, उनको घर भेजा जा चुका है। तो सबसे अच्छी बात यह है। और सरकार ने दो बड़े अहम फैसले लिए हैं। एक तो अभी अब से थोड़ी देर पहले ही गजट नोटिफिकेशन जारी हुआ है कि जो हाइड्रो क्लोरोक्विन दवा है उसको लेकर के सरकार ने अधिसूचना जारी की है कि इसकी बिक्री को लेकर के, और ये उन लोगों के लिए उपयोग में आने वाली दवा है जो संक्रमित है और उनका इलाज कर रहे हैं, कांटेक्ट में है डॉक्टर या नर्सेज, उनको ये दवा लेने के लिए सरकार ने अधिसूचना जारी की है। इसके अलावा जो लोग संक्रमित है और उनका घर पे क्वारंटाइन है, वो उनके क्लोज कांटेक्ट में है, उनको वो ये दवा उपयोग में लाई जा सकती है उनके लिए। तो ये तमाम जो बड़े फैसले सरकार की तरफ से लिए जा रहे हैं वो इसलिए हैं कि प्रिवेंटिव मेजर हैं। और सरकार ने ऑनलाइन दवा की बिक्री के लिए भी एक गाइडलाइन जारी की है, एक दिशा निर्देश जारी की है कि और एक ऐप भी जारी किया जा रहा है कि लोग घरों में बैठे बैठे ही अपनी दवा को मंगा सकते हैं। इसके लिए डिटेल गाइडलाइन जारी की गई है। और ये तमाम प्रयास ये हो रहा है कि जो लॉकडाउन 21 दिन के लिए बनाया गया है सरकार की तरफ से, जो आदेश एक तरह से जारी किया गया है, उसका पालन पूरी तरीके से करें लोग, और किसी भी लोगों को कोई कमी न हो, चाहे वो दवा हो या फिर खाने की चीज हो, वो घर तक उनके पहुंचे। इसलिए ये तमाम कदम उठाए जा रहे हैं कि किसी को बाहर निकलने की जरूरत न पड़े, घरों के अंदर ही उनको जरूरी दवा मिल जाए, जरूरी खाने पीने की चीजें मिल जाए। इसलिए ऑनलाइन होम डिलीवरी पे ज्यादा जोर है सरकार का। और ये अहम इस बात को लेकर के भी है कि अगर आप 21 दिन तक घरों में रहेंगे तो जो इसका चेन है संक्रमण का स्प्रेड करने का, उसको तोड़ने में कामयाबी मिलेगी। और इस वक्त बहुत ही बिल्कुल सही फैसला है सरकार का कि अगर इस दौरान आप घरों में रहेंगे तो स्प्रेड करने की जो रेट है उसको कम कर पाएंगे। क्योंकि जो अभी बाहर से जितने भी लोग आए हैं संक्रमित देश से, उनका जो इंक्यूबेशन पीरियड जो है 14 दिन का, वो करीब करीब पूरा होने वाला है। तो अगर जो लोग आए हैं तो उनके जो इस दौरान अगर वो संक्रमित है तो उनके सिम्टम्स अब तक सामने आ जाएंगे, और वो किसी को अगर भीड़ में नहीं जाए या कहीं दूसरे के संपर्क में नहीं आए तो वो फैलेगा नहीं, घरों में रहेंगे। तो दूसरी जो लोग आसपास में अपने आसपास के भीड़ चौराहों पे या फिर किसी समारोह में नहीं जाएंगे तो वो संक्रमित होने से बचेंगे। इसलिए 21 दिन का ये जो लॉकडाउन है उसको पूरा करें और घरों में रहें।
Oh yes, absolutely. The criticality of this 21-day period, the nationwide lockdown as announced by Prime Minister Modi, cannot be undermined any further, because this is clearly to break the chain of transmission, like you're explaining to us, Nitendra, and at the same time making sure that the essential goods and services reach out to people so that they don't really have to venture out as much for the supply of the essential goods and commodities. And of course, medicines being very critical in the daily life of those with any underlying medical condition. The patients going to be receiving all the medicines there at home. The home delivery of the pharmacies has also been ensured. Thanks, Nitendra, very much for joining us for the moment. We'll of course keep coming back to you for regular inputs, but joining us at the moment is also correspondent from Bengaluru, Aisha Khanam is with us. Aisha, good morning. Just take us through how is the morning really panning out for people there in Bangalore and the entire state of Karnataka as far as essential supply of goods and services is concerned in this 21-day period nationwide lockdown.
Well, good morning, Nancy. Karnataka government has been able to manage the situation so far in a very efficient and very good manner because it was in Karnataka that the first, India's first COVID patient death was reported. So since then, Karnataka government has been working in a war situation, in a war mode. And the Karnataka government has been able to manage this efficiently so far. And till now in Karnataka, the COVID cases have risen to 55 only, and whereas 2 deaths have been reported. But the good thing is that 3 people have been discharged and they have gone home. And the one good aspect of the story is that the elderly person who died in Gulbarga district, who was a COVID case, and his family member is also on the way to recovery. So his daughter will be discharged soon from the hospital. So these are the good news that the Karnataka government is sharing with the people of Karnataka, and the government is also emphasizing on the fact that social distancing is the only way to
Right.
control this virus. And so far as the essential supplies are concerned in the state, there is no panic buying as far as Bangalore is
Okay.
concerned, at least. There was some crowds near the market areas, and the police have been having tough time in convincing people to go back homes. And also the Karnataka government has ensured that the essential supplies will be delivered to their doorstep. So the e-commerce websites will be active now. The government, the police is giving them passes to the delivery boys to reach home to supply the essential groceries and other essential materials. And as far as the Karnataka government's efforts to maintain social distancing, ask the people to maintain social distancing is concerned, people have realized the importance of social distancing, and we see that very clear outside the grocery stores, outside the milk booths, where people stand 1 meter distance apart. And this is how slowly the importance of social distancing is sinking in.
Absolutely.
And at the moment, people have realized that the only way to fight coronavirus is precautions and social distancing, which the government has been taking care to reach out to the people.
Absolutely. In fact, there are people adhering and complying with the nationwide lockdown and maintaining social distancing. Well, that's something really great that, we're getting to see from visuals across the country, Aisha. And of course, like you're saying, that the essential goods and services being supplied to people at their homes, that is also something that is being made sure. Thanks very much, Aisha, for joining us for the moment and sharing all those inputs. Well, stay safe, stay home, take care of yourself and take care of your dear ones as well. And amid the coronavirus outbreak in the country, the Odisha government has taken the first-hand initiative to set up the largest COVID-19 hospital in the country. This establishment will consist of about 1,000 beds and will be functional in a period of 2 weeks. Odisha will be the first state in the country to set up such a large-scale hospital exclusively to treat COVID-19 patients once this hospital is established. The Kalinga Institute of Medical Sciences has signed a memorandum of understanding with the Odisha government to set up a special hospital to combat the spread of the novel coronavirus in the state. However, this is one of its kind initiative by the government and the hospital to ensure that the people of Odisha get state-of-the-art infrastructure and the services of the best doctors to treat and tackle the pandemic. And the governments throughout the country are taking all the measures to make people follow the nationwide lockdown strictly. Efforts are being made to ensure the supply of essential commodities in various states and union territories. In Maharashtra, as the COVID-19 cases continue to rise, shopkeepers and vegetable vendors have adopted many ways to maintain a fixed distance between the buyers, while people at many places are welcoming it and also implementing the same. In West Bengal, social workers are distributing food to the poor people at the Damdam railway station amid the coronavirus lockdown in Kolkata. And these visuals that we're getting from across the country, clearly the need of helping one another in these very challenging, unprecedented times that stand before all of us. In Himachal Pradesh, people participated in Hanuman Aarti from their balconies and terraces in the Kullu district amid the nationwide lockdown. There you can see those visuals from Kullu in Himachal Pradesh, where people went up to their balconies, maintaining social distancing, but one in voice and praying obeisance. In Uttar Pradesh, essential goods and services are also being transported to the houses of people with doorstep delivery services. The state government has also opened a community kitchen and distributing food packets to the poor and the needy. In Hyderabad, the vegetable sellers have taken steps to maintaining social distancing to avoid the spread of coronavirus. The Chief Minister of Himachal Pradesh, Jairam Thakur, also took stock of the availability of all the essential items following the nationwide lockdown. The The Chief Minister directed the authorities to maintain the supply chain of essential commodities so that no one has to face hunger due to the spread of the pandemic. He's also asked shops to follow guidelines related to social distancing, such as keeping sufficient distance from each other while distributing essential items to the consumers. He's appealed to the public to refrain from hoarding and storing in a state of panic. In Delhi, the Chief Minister Arvind Kejriwal is informed that the process of feeding poor and the needy in the capital has already begun in some areas that will soon be extended to other places as well. He said that social distancing is being maintained at the same time. And in their outreach towards the citizens, Bihar has come up with new initiative to reach out to its citizens currently stuck amidst nationwide lockdown in different parts of the country. The state has issued helpline numbers for such distressed people who are facing the gruesome conditions. The issued helpline numbers are 011-237-92-009, 011-2301-4326 and 011-2301-3884. The World Health Organization Director General has called on the G20 leaders to fight, unite and ignite against COVID-19 as the outbreak rages across the globe with over 4.5 lakh confirmed cases and over 21,000 deaths. The WHO chief welcomed the G20's initiative to find joint solutions and work together, saying this is a global crisis that requires a global response. He's also welcomed G20 leaders' commitment to do whatever it takes to overcome the pandemic to protect lives and livelihoods. The G20 committed to support and further strengthen WHO's mandate in coordinating and response and called for full funding of WHO's strategic preparedness and the response plan. And the United States has now confirmed more cases of coronavirus than any other country, with more than 83,500 positive tests. According to the latest figures, the U.S. has overtaken China and Italy. However, with 1,200 COVID-19 related fatalities, the U.S. death toll lags behind China and Italy. The grim milestone came as President Donald Trump predicted the nation would get back to work pretty quickly. And people from all walks of life have appealed to all the citizens to stay at home and follow the rules amid the lockdown. Take a look.
मेरे देशवासियों, भाई बहनों, हम सब जानते हैं कि आज हम प्रकृति के किस प्रकोप से गुजर रहे हैं और इसी प्रकोप जिसे हम कोरोना वायरस कहते हैं, इसी को समझते हुए हमारे भारत के प्रधानमंत्री जी ने भारत में 21 दिन का लॉकडाउन किया है ताकि हम इस महामारी से बच सकें। मैं दूरदर्शन के माध्यम से ये आपसे विनती करना चाहूँगा कि आप प्लीज़ सरकार के बनाए हुए नियम, डॉक्टर्स की जो पूरी सलाह और मेडिकल इंस्टीट्यूशंस की कंसल्टेशंस और उनके नियम को पूरा पालन करें। हमेशा घर पर ही रहें, घर से बाहर ना जाएं बेवजह, और कोई भी चीज़ को छूने से पहले अपने हाथ को सैनिटाइज कर लें, क्योंकि ये हमारे लिए बहुत ज़रूरी है। आज हमें अपने परिवार, अपने समाज, अपने देश को बचाना है और अगर हम ये संकल्प आज कर लेते हैं और दृढ़ निश्चय कर लेते हैं कि हम हर नियम का पूरा पालन करेंगे, तो मैं आश्वासन के साथ, पूरे संतुष्टि के साथ कह सकता हूं कि हमारा भारत इस प्रकोप से बच जाएगा। आप हम फिर आपस में मिल सकेंगे, इस भारत को आगे ले जा सकेंगे। जय हिंद।
मैं हूं दिव्या दत्ता और आप सबसे गुजारिश करती हूं कि जैसा हमारे प्रधानमंत्री जी ने कहा है कि भारत इस वक्त एक लॉकडाउन सिचुएशन में है, सो प्लीज़ विनती आपसे, आप अपने घर पर रहें और वो चीज़ें करें जो शायद आपको करने का मौका ही नहीं मिला। अपने फैमिली के साथ एक बॉन्ड बढ़ाएं, खाना बनाएं, साफ़ सफाइयाँ करें, हंसें खेलें, मस्ती करें, योगा करें, मेडिटेशंस करें, वीडियो कॉल्स करें, फिल्में देखें, लिखें, कुछ ऐसी हॉबीज़ ढूंढें जो शायद आपको मालूम ही नहीं थी कि आपके पास हैं। आप ये सब करेंगे, 21 दिन फट से बीत जाएंगे और हम अगर एक साथ हैं तो हम कोरोना वायरस को ये मात दे सकते हैं। सो प्लीज़ अपने घर पर रहिए और देखते रहिए दूरदर्शन न्यूज़।
So take care of yourself in these difficult times, and we shall overcome it very soon. And with that, it's a wrap on this edition of the news, but news and updates will continue here on Doordarshan News. Thanks for being with us.